Welcome to the Deep Dive, the show where we take a stack of sources, articles, research, and our own notes, and really try to distill them into the most important nuggets of knowledge for you, our listener. Today we're plunging into a conversation that has truly transformed over the last few decades. When is the right time to start a family? It's a question loaded with, well, deeply personal desires, societal expectations that seem to constantly shift, and of course those undeniable biological realities. The traditional narratives about peak fertility, they're being profoundly reevaluated, and more people are asking this very question as they navigate their own life paths.
Indeed. And what's fascinating here is how fundamentally the landscape of family planning has shifted. I mean, really shifted. We're moving far beyond older, often, let's be honest, stigmatizing terms, to embrace a much more nuanced and informed discussion about the myriad individual pathways to parenthood. It's no longer a simple linear path, but a truly dynamic interplay between biological predispositions and the complex choices we make in modern life.
Absolutely. So our mission today is to embark on a comprehensive deep dive into the complexities of fertility and pregnancy across different decades of life, from your 20s right through to your 40s and even beyond. We'll explore the underlying biological realities, significant societal shifts, the potential risks involved, some truly surprising benefits you might not expect, and the cutting-edge medical advancements that are utterly reshaping what's possible for aspiring parents. Our sources for this deep dive come from extensive articles on BabyCenter, a well-regarded and trusted resource for expecting and new parents. Our goal is to provide you with a comprehensive, nuanced understanding so you can feel truly well-informed about this profoundly personal and often pivotal journey. Okay, let's unpack this. There's so much conventional wisdom floating around about when to have children, influenced by everything from, grandparents to social media. But what does the latest science actually say? And how are the realities of modern lives, careers, finances, relationships truly shaping these deeply personal decisions?
It's a vital discussion because, as you said, the conventional wisdom often only captures a fragment of the story, just a piece of it. While biology does present a clear, optimal window for fertility, human lives are, by their very nature, far more intricate and multi-layered than pure biological programming. This is where the true deep dive begins, really getting into the weeds.
Exactly. So let's begin where nature ostensibly intends, with the biological blueprint fertility in your 20s. This decade is almost universally described as nature's absolute prime time for conception and carrying a baby, from a purely physiological standpoint, right?
That's spot on. From a purely biological vantage point, the average woman's fertility peaks quite definitively in her early to mid-20s. That's the peak. This is the period when your body is biologically at its absolute most optimally prepared for both conception and carrying a pregnancy to term. To really put this into perspective, consider the incredible biological endowment you begin with. A woman is born with an astonishing 1 to 2 million eggs.
1 to 2 million. Wow.
Yeah, it's huge. However, by the time puberty arrives, this immense number drastically reduces to approximately 300,000 to 500,000. And here's another striking fact. Throughout your entire reproductive life, your ovaries will only ever release about 300 mature eggs. Just 300. The rest simply dissipate. This finite, dwindling supply is what makes the timing so critical from a biological perspective.
That's a massive drop-off, really highlighting the precious and, well, finite nature of a woman's egg supply. So when we talk about this peak fertility in the 20s, what do the actual success rates look like in terms of getting pregnant? What are the probabilities we're talking about?
Well, the numbers are overwhelmingly favorable, painting a really clear picture of biological efficiency. In your mid-20s, a healthy, fertile woman has approximately a 33% chance of getting pregnant each individual cycle. Each month, exactly, if she's consistently having sex a day or two before ovulation. Breaking it down over longer periods, which is often more indicative of real-world experience, women between the ages of 21 and 24 have an impressive 57% chance of achieving pregnancy within 6 cycles of trying, and that climbs to a substantial 71% chance within 12 cycles, so within a year.
Okay, those are pretty good odds.
Very good. For those aged 25 to 27, the success rates are equally robust. 59% within 6 cycles and 79% within 12 cycles. And even as you approach the end of the decade from ages 28 to 30, it remains very high at 62% within 6 cycles and 78% within 12 cycles. It's also critically important to note that a remarkably low percentage, only about 6% of 20-year-old women, struggle with infertility, which is significantly lower compared to older age groups.
Those are undeniably compelling statistics. They paint a
Mhm.
very clear picture of why the 20s are considered biologically ideal, almost like a perfect storm of reproductive readiness. And it's not just about the ease of getting pregnant, it's also about significantly lower health risks during pregnancy for both mother and baby, right?
Precisely. The risks associated with pregnancy for both the expectant mother and the developing baby are generally at their absolute lowest in your 20s, really the lowest point. Let's look at some key figures. For instance, the risk of miscarriage hovers around 10% in your 20s. Now, to truly grasp the significance of this, consider the escalating risks as you age. This risk increases to 12% in your early 30s, then to 18% in your mid to late 30s, a quite significant 34% in your early 40s, and then jumps dramatically to an estimated 53% by age 45.
Wow, that miscarriage risk escalation is stark, especially as you get into the later decades. It really underscores the profound biological advantage of youth. And what about chromosomal abnormalities, something many people quite rightly worry about as they consider later pregnancies?
That's another incredibly significant benefit of conceiving in your 20s. The eggs are far less likely to harbor genetic abnormalities that can lead to conditions like Down syndrome. For example, the risk of conceiving a child with Down syndrome is remarkably low, about 1 in 2,000 at age 20, just 1 in 2,000. This risk, as we'll discuss shortly, increases exponentially with maternal age. Furthermore, pregnant women in their 20s face a significantly lower risk of developing common health complications during pregnancy, such as high blood pressure, often termed gestational hypertension, or gestational diabetes. They're also less prone to experiencing gynecological problems like uterine fibroids, which are, benign growths that often become more prevalent and symptomatic over time, potentially complicating pregnancy. And crucially, there's a lower likelihood of having premature babies or babies born with low birth weight, both of which can have long-term health implications.
So from a purely medical standpoint, biology is definitely on your side. But beyond the clinical aspects, are there also societal and personal advantages that often accompany early parenthood?
Absolutely. 20-something mothers often possess a remarkable physical resilience, which is an invaluable asset for coping with the relentless demands of a new baby, particularly the inevitable and profound sleep deprivation. Let's face it, that's tough. They also tend to find themselves within a larger, more organic peer group of new parents, given that the average American woman has her first child around age 26. This commonality can foster a stronger sense of community, shared experience, and mutual support, which is truly invaluable during the often isolating early stages of parenthood. You have built-in playdates, shared grievances, and collective triumphs.
Yeah, that building community must be huge. And from a relationship perspective, I've heard it suggested that younger couples might have certain advantages in adapting to the seismic shift of parenthood. Is there something to that?
Yes, that's often the case. There can be a greater inherent flexibility for both the marriage itself and the immense transition to parenthood when couples are younger. As one expert we looked at noted, when people marry later in life having already established independent lives and routines, there's often a tendency towards my way and your way.
Right, entrenched habits.
Exactly. This can make the process of merging lives, let alone merging parenting styles, far more complicated. Younger couples, who are often still growing and defining themselves together, may find it inherently easier to adapt and build a truly shared, our way approach to life with a child, without as many entrenched habits to break down. This period of life can forge a powerful bond through shared challenge.
Okay, here's where it gets really interesting. While biology screams now, and there are these compelling social advantages, life often tells a profoundly different and more complex story for women in their 20s. Despite all these biological primes and some social benefits, delaying parenthood is a rapidly accelerating trend. What are some of the considerations or even significant drawbacks for those who don't choose to have children in their 20s?
This raises an important question. How do we meaningfully balance this biological readiness with the evolving societal norms and deeply personal individual aspirations that define modern life? One of the most significant considerations, which often drives the decision to delay, is career and professional development. Taking significant time out or even just shifting focus for a baby in your 20s can make it considerably harder to establish a solid career path or to regain momentum once you re-enter the workforce.
That's the mommy tax we often hear about, isn't it? The economic impact that motherhood can have, often stretching over a woman's entire career.
Precisely. Author Ann Crittenden powerfully coined the term mommy tax to vividly describe the profound economic toll motherhood can inflict on a woman's lifetime earning potential. Statistically, even if a woman returns to work immediately after having children, she may, on average, earn significantly less over her career compared to her childless counterparts. This isn't just about lost wages in the short term, it can cascade into reduced retirement savings, fewer promotions, and a subtle but pervasive devaluing of parental leave in corporate culture. It forces a long-term financial calculation that often pits family against financial independence, creating a powerful incentive for women to delay pregnancy. Those who have children later in life often manage to achieve higher lifetime earnings and access a wider range of professional opportunities precisely because they've had more time to build their careers before the demands of motherhood enter the picture.
And beyond the career implications, there's the sheer financial strain of raising a child, which can be particularly acute for younger adults who might still be establishing themselves economically.
Absolutely. Many younger individuals in their 20s and early 30s are already grappling with substantial burdens like college loan debt, credit card debt, and the rising cost of living. When you factor in the high cost of raising a child, which our sources indicate can add up to approximately $23,380 per year on the high end.
$23,000 a year. Wow.
Yeah, it's a big number. This financial challenge becomes a truly monumental obstacle for young couples. Imagine trying to chip away at 5 or 6 figures of student loans while simultaneously trying to fund diapers, childcare, and future college savings for a new baby. It's incredibly daunting.
I can only imagine how overwhelming that figure must look when you're still navigating student loans and trying to get your financial footing. And what about the impact on relationships? Parenthood is tough at any age, but for younger couples, are there unique hurdles that can emerge?
Yes, there can be very specific challenges. This isn't to say younger couples can't succeed, far from it, but they often face unique developmental pressures. Imagine navigating severe sleep deprivation and the constant, relentless demands of a newborn, while simultaneously trying to solidify your own identities as adults, dealing with student loan debt, and perhaps still building foundational career skills. This can strain even the strongest existing bonds. As a psychotherapist quoted in our sources highlighted, a young mother might find herself feeling profoundly depressed and overwhelmed, completely preoccupied with the baby, while the father might feel abandoned or neglected. Ideally, couples support each other and grow closer through these trials, but unfortunately, without that pre-existing bedrock of shared life experience and communication strategies, many young couples can indeed grow distant and alienated, which can seriously damage the marriage. There's also the critical point that many couples in their 20s, while perhaps emotionally ready, may not be fully prepared for the significant and sustained sacrifice, the immense patience, and the profound shift in priorities that raising children truly requires.
So it becomes clear that while the 20s undoubtedly offer biological primes, the practicalities of modern life, the fierce competition in careers, the crushing weight of financial debt, and even the developmental stage of relationships often present a far more complex and challenging picture than pure biology suggests. This brings us perfectly into our next exploration. The modern middle ground, fertility in your 30s.
Exactly. The 30s have become, in many ways, the new norm for starting families. I mean, really the norm now. For the first time in history, women in their 30s are now having more babies than women in their 20s. The average age for first-time mothers in the U.S. has notably risen to 26 overall, and it's even higher for male partners at 31. This is a truly significant demographic shift, especially when you compare it to the 1970s, when the average age for first-time mothers was a mere 21. It speaks volumes about evolving priorities and possibilities.
That's a seismic shift, not just a minor adjustment. It indicates a fundamental reevaluation of when and how to start a family. What are the primary reasons we're seeing this widespread delay into the 30s?
There are several compelling and interconnected reasons driving this trend. Financial security is very often cited as the #1 factor. A significant 2020 survey revealed that 60% of respondents explicitly wanted more savings, and 51% stated they desired higher salaries before taking on the responsibilities of parenthood. As we just explored, the high and ever-increasing cost of raising a child, potentially up to that $23,380 per year figure, is a formidable financial hurdle that many adults in their 20s simply aren't equipped to clear.
And it's not just about personal finances. Broader health implications and shifting societal norms, particularly around career, play a substantial role too.
Indeed. The same 2020 survey indicated lingering concerns about health implications, specifically the impact of global health crises like COVID-19, access to comprehensive prenatal care, and critically, the affordability of fertility treatments for those who might need them. Conversely, the increased access to and reliability of various birth control methods has given women unprecedented control over their reproductive timeline, allowing for intentional delays. Social norms and career aspirations are also huge drivers. Many women feel a strong desire, and indeed a societal pressure, to establish stable careers, achieve specific professional milestones, or secure leadership positions before starting a family. The notable lack of mandated paid maternity leave in the U.S., coupled with the persistent wage penalty that mothers face, where they can earn up to 20% less than childless counterparts over their careers, also powerfully incentivizes women to delay, seeking to minimize that economic impact.
So it's a complex tapestry woven from financial, health, and career factors, but also the increasing accessibility and acceptance of assisted reproductive technologies, or RT, must be playing a huge part, right?
Absolutely. The increased awareness, accessibility, and significantly reduced societal taboo around fertility treatments like egg freezing and in vitro fertilization, or IVF, offer tangible and often highly successful options for later parenthood. These technologies essentially provide a powerful safety net, allowing women to proactively pursue other significant life goals, whether it's education, career advancement, or personal growth, before fully focusing on family building. It's about leveraging science to expand personal agency.
This truly sounds like a period of greater agency and deliberate choice.
Mhm.
But how does fertility itself physically shift during the 30s? Is it a sudden, dramatic drop-off or something more gradual that people can plan around?
It's generally a gradual decrease, which is important to understand, but with a more notably rapid decline as you move into the later part of the decade, typically after age 37. Fertility does slowly start its decline at age 30. At that point, you still have about a 20% chance of getting pregnant each month you try, which is still quite robust, but a subtle dip from the mid-20s peak.
Okay, still pretty good odds per month. And how do those cumulative success rates look over longer periods for women in their 30s? How do they compare to the 20s over, say, 6 or 12 cycles?
The numbers remain encouraging, but show a clear trend. For women aged 31 to 33, there's still a solid 61% chance of pregnancy within 6 cycles and a 77% chance within 12 cycles. As you move into the mid-30s, for those aged 34 to 36, it's 56% within 6 cycles and 75% within 12 cycles. Still quite high. And finally, for ages 37 to 39, the numbers continue to dip, reaching 46% within 6 cycles and 67% within 12 cycles. This clearly illustrates that while fertility in the 30s is still good, there's a noticeable and measurable shift compared to the 20s, becoming more pronounced, particularly as you approach your late 30s. Not a cliff edge, but certainly a gradual, persistent slope downwards.
So not a sudden cliff, but rather a persistent, albeit gentle, slope downwards. And this decline, as you mentioned earlier, is fundamentally linked to egg quality and quantity, isn't it?
Yes, that's the core biological reality at play. Women are born with all the eggs they will ever possess, a fixed endowment that cannot be replenished. As you age, both the sheer quantity of these eggs and, critically, their quality begin to diminish. This reduction in quality translates to a higher likelihood of eggs carrying abnormal chromosome numbers, which, if fertilized, can unfortunately lead to miscarriage or the development of chromosomal abnormalities in a baby, such as Down syndrome. It's a natural and unavoidable biological process.
This brings us directly to the potential risks that become more prevalent for women conceiving in their 30s, especially in the late 30s. What are the key concerns that women and their partners need to be aware of during this decade?
The risk of miscarriage, for example, really starts to climb noticeably in your mid-30s. At age 35, the risk is approximately 20%. By age 40, it jumps to around 40%, and by age 45, it's an estimated 80%. It really escalates. A majority of these miscarriages are attributed to those abnormal chromosome numbers we just discussed, reflecting the declining egg quality. Beyond that, the risk of chromosomal abnormalities like Down syndrome also increases. While still relatively low for most of the 30s, the risk of Down syndrome rises to 1 in 350 at age 35 and then to 1 in 100 at age 40. Furthermore, there's an increased risk for other pregnancy complications such as ectopic pregnancy, where the fertilized egg implants outside the uterus, preeclampsia, a serious high blood pressure disorder, and gestational diabetes. It's also crucial to note that pre-existing chronic health conditions, such as obesity, chronic hypertension, and type 2 diabetes, become more prevalent in this age group, and these conditions can significantly complicate pregnancy outcomes.
I've also heard about a higher rate of C-sections for mothers in their 30s. Is that accurate? And if so, what are the contributing factors?
That's quite accurate. Women over 35 face about a 43% chance of a C-section delivery, compared to roughly 30% for women in their 20s. This is often due to a combination of factors. Older mothers can be more prone to prolonged labor due to less efficient uterine contractions, or they might experience higher rates of fetal distress during labor, necessitating a surgical intervention. And, somewhat surprisingly, women aged 35 to 39 are slightly more likely to conceive twins naturally.
Twins. Naturally.
Hmm.
That's really interesting. What's the biological reason behind that increased twin rate without the aid of fertility treatments?
It's largely attributed to increased follicle-stimulating hormone, or FSH, levels as women age. As the ovaries begin to slow down and prepare for menopause, the body sends more FSH signals to try and stimulate egg production. This higher FSH can, counterintuitively, lead to the ovaries occasionally releasing more than one egg per cycle, thereby naturally increasing the odds of a multiple birth.
Huh. Fascinating. Despite these shifts and potential risks that become more apparent in the 30s, there are also significant and sometimes overlooked benefits to parenthood in this decade, aren't there? It's certainly not all about the challenges.
Absolutely. The advantages are quite compelling and often explain why so many women are choosing to delay. Women in their 30s have generally had more time to firmly establish their careers, leading to higher income and greater financial security. This can significantly reduce the intense financial stress often associated with early parenthood, allowing for more resources and stability for the growing family. They're often homeowners, have built significant savings, and are more confident in their earning potential.
And there are even some fascinating studies that link later motherhood to longevity and even a distinct parenting style. That feels quite surprising.
It does. For instance, some studies suggest that first-time mothers who have their babies at or after age 33 have greater odds of living to age 95 and beyond.
95?
Hmm.
Really?
Yes. While the direct biological mechanism linking later childbearing to longevity isn't fully understood, some theories suggest this isn't simply a coincidence. It could reflect a lifestyle. Women who delay childbearing often have established healthier habits, greater financial stability, and perhaps a lower baseline stress from having their lives more firmly in order. All of these factors are independently known to contribute to increased longevity. So it's less about the baby itself making you live longer, and more about the advantageous characteristics and life choices often aligned with later parenthood. Furthermore, research has indicated that children of older mothers may exhibit fewer behavioral, social, and emotional problems, and these mothers may be less likely to resort to verbal or physical punishment. This suggests the potential for a more mature, more patient, and perhaps calmer parenting approach, leveraging a cumulative life experience.
So for those in their 30s who are actively trying to conceive, what proactive steps can they take to maximize their fertility and optimize their chances, given these biological shifts?
There's quite a lot you can do to optimize your chances, taking a holistic approach. Lifestyle choices are paramount. This includes conscientiously limiting alcohol consumption and keeping caffeine intake under 200 milligrams a day, which is roughly equivalent to one large cup of filter coffee. Eating a healthy, balanced diet is crucial. Focus on a wide variety of whole grains, plenty of fresh produce, lean proteins, and healthy fats. Equally important is avoiding potentially dangerous foods during pregnancy, like undercooked meats or fish high in mercury, and unpasteurized products. Maintaining a healthy body mass index, or BMI, is also incredibly important, as studies have consistently found that both a BMI that is too high or too low can make it harder to conceive.
And supplements. Are there specific recommendations that go beyond just a general healthy diet?
Yes, absolutely. Starting a prenatal vitamin with at least 400 micrograms of folic acid daily is highly recommended for all women trying to conceive, ideally starting at least a month before trying. This is vital for helping to prevent neural tube defects very early in pregnancy. Your healthcare provider might also suggest additional supplements like vitamin D, especially if you live in a less sunny climate, or CoQ10.
CoQ10.
Yeah, coenzyme Q10. Some preliminary studies have shown CoQ10 can potentially improve egg quality by supporting mitochondrial function. But always consult your doctor before starting new supplements, of course.
Good advice. Beyond diet and supplements, what about overall well-being and practical day-to-day tips for optimizing chances of conception?
Prioritizing good, consistent sleep, aiming for 7 to 8 hours a night, is key, as it plays a significant role in balancing your hormones, which are critical for ovulation and overall fertility. Stress reduction through practices like yoga, meditation, therapy, or journaling is also very beneficial. While the direct causal link between stress and infertility isn't always crystal clear, managing chronic stress can certainly improve overall health and well-being, which indirectly supports fertility. On a very practical note, meticulously tracking your cycle using apps or ovulation predictor kits, often called OPKs, can help you pinpoint the precise window for optimal timing of intercourse. This is typically the 2 days leading up to and including ovulation itself, timing it right.
We've focused a lot on female fertility, but it's crucial to remember that a male partner's health is just as significant a factor, isn't it? It's a two-person equation.
Absolutely. Crucial. It's vital for male partners to maintain healthy sperm. This means engaging in regular exercise, consuming a healthy and balanced diet, unequivocally quitting smoking, and avoiding excessive time in hot tubs or saunas, as high temperatures can negatively impact sperm production. For some men, especially if there are concerns about sperm count or concentration, even considering loose-fitting underwear might be suggested, although this isn't a universal recommendation for most men. Overall health, hydration, and avoiding toxins are key for both partners. It really takes two.
That's a comprehensive list of actionable steps. Given these natural shifts in fertility as women move through their 30s, when should someone consider seeing a fertility specialist? What's the general guideline that indicates it might be time for expert intervention?
The general rule of thumb is very clear and adjusted for age. If you're under 35 and have been having frequent, unprotected sex, that's about 2 to 3 times a week, for 1 full year without becoming pregnant, it's advisable to consult a fertility specialist. However, if you are 35 or older, that timeline shortens significantly. You should see a specialist after 6 months of frequent, unprotected sex without achieving pregnancy.
6 months if you're 35 or older.
Correct. The reason for this accelerated timeline is precisely because of the natural and more rapid decline in fertility after 35, making early intervention potentially more effective. Time is more of the essence, you could say.
And are there specific circumstances or pre-existing conditions where someone should seek consultation even sooner than those general guidelines, regardless of how long they've been trying?
Yes, definitely. It's always advisable to seek consultation sooner if you have known or suspected underlying issues. This includes a history of irregular or consistently missed periods, which can signal ovulatory dysfunction, a history of sexually transmitted diseases that might have caused damage, unexplained chronic pelvic pain, which could indicate conditions like endometriosis, or if there's a pre-existing diagnosis of male factor infertility for your partner. In such cases, a proactive approach is best. Don't wait the full year or 6 months. During an initial evaluation, the specialist will typically conduct blood tests to assess ovarian function and hormone levels, perform a hysterosalpingogram, or HSG.
HSG.
Yeah, it's an X-ray procedure to examine the fallopian tubes and uterus for blockages or abnormalities. And they'll also perform a comprehensive semen analysis for the male partner to assess sperm health, get the full picture.
So what does this all mean? The 30s are clearly a dynamic and increasingly popular period for starting families, balancing these very real biological changes with significant personal growth and expanded life opportunities.
If we connect this to the bigger picture, it highlights a profound shift in how modern women are leveraging choice, agency, and medical advancements to align their family planning with their broader life goals and established identities, even as fertility naturally shifts. It's about being deeply informed and proactively making decisions that reflect a well-considered path to parenthood, rather than simply following a traditional timeline. More intentional, you know.
And that proactive, informed approach becomes even more critically important and indeed more complex as we move into the later decades of life. Let's shift our focus now to Section 3, beyond the threshold pregnancy after 35 and 40. One of the first things that often arises in this discussion is the terminology used, and many people have heard the term geriatric pregnancy, but that's truly not the preferred or accurate term anymore, is it?
You're absolutely right, and it's an important point for reducing outdated stigma. The term geriatric pregnancy is indeed outdated and has largely been replaced by advanced maternal age, or AMA. This refers to pregnancies in women aged 35 or older. It's crucial to understand that AMA is simply a medical identifier used by healthcare providers. Its purpose is to help identify potential pregnancy risk factors that may become more prevalent with age, not to pass judgment or imply, decrepitude about the expectant mother. It's purely a clinical designation, a flag for increased monitoring.
Right, so it's just a way for medical professionals to flag potential considerations and ensure appropriate care, not a value judgment on the woman herself. Are there even further classifications beyond AMA as women move into their 40s?
Yes, the classifications become even more specific to reflect the gradual increase in potential considerations. For women older than 40, the pregnancy is typically classified as very advanced maternal age, or VAMA. And if a woman is over 45, it's considered very late maternal age, or extremely advanced maternal age, or EAM. While you might, on rare occasion, still encounter geriatric pregnancy on older medical charts due to legacy billing codes or outdated systems, the medical community actively uses these more precise and significantly less stigmatizing terms. It reflects a more respectful and accurate approach to discussing later pregnancies.
It's truly beneficial to understand the evolving language around this. And it seems that despite these medical classifications, delaying pregnancy is not just a trend, but a clear and accelerating societal shift. What do the latest numbers tell us about this growing prevalence of later pregnancies?
The statistics are quite striking and demonstrate a profound societal transformation. Approximately 20% of women in the U.S. now have their first child after age 35. This isn't a small niche, it's a significant portion of the population, 1 in 5. Data from the Centers for Disease Control and Prevention reports that the birth rate among mothers aged 35 to 39 has risen by an astounding 272% in the last 40 years alone.
272%. That's huge.
It's massive, and for women aged 40 to 44, the rate has increased an even more dramatic 318% over the same period. Preliminary data for 2022 indicates this trend is continuing unabated, with birth rates for women aged 35 to 39 rising another 2%, and for those aged 40 to 44, a 4% increase. These are not minor fluctuations. They represent a fundamental repatterning of family timelines across society.
Those are truly significant increases. It's not just a few outliers making individual choices. This is a widespread societal shift with profound implications. What are the main drivers behind this continued and accelerating trend of later pregnancies? Why are so many women pushing beyond these biological thresholds? Many of the reasons we discussed for women in their 30s hold true and often intensify for those waiting until their late 30s or 40s. The benefits include having significantly more time to develop substantial careers, establish greater financial security, find a truly stable and compatible partner, or simply become more emotionally and psychologically ready for the profound commitment of parenthood. For many, delaying allows them to feel more grounded, more confident, and better resourced. Crucially, the significant advancements in assisted reproductive technologies, which we'll delve into shortly, also play an absolutely critical role, providing viable pathways to pregnancy that simply didn't exist for previous generations. This scientific safety net has empowered many to delay without feeling they're closing the door on motherhood entirely. It's clear that women are making very intentional, empowered choices, backed by evolving societal norms and scientific progress. But we also need to address the increased risks that inevitably come with pregnancy after 35, and especially after 40. What are the primary concerns regarding the natural decline in fertility in these later years?
Unfortunately, the decline in natural fertility becomes quite steep and pronounced once a woman enters her 40s. By age 45, getting pregnant naturally with your own eggs is considered, from a statistical standpoint, unlikely. The sheer number of viable eggs has significantly diminished, and the quality of the remaining eggs has often deteriorated. At age 40, a woman has only about a 5% to 10% chance of getting pregnant per menstrual cycle.
Only 5 to 10% per month.
Right. While it's still possible, women in their early 40s, for example, have a 28% chance of pregnancy within 6 cycles and a 56% chance within 12 cycles, so over half might conceive within a year. But by age 43, that chance drops dramatically to only 1% or 2% within a year. It's a stark reminder that while the desire for children may be strong, biology presents increasing headwinds.
So the biological clock is definitely ticking much louder in your 40s. And this decline, as you mentioned, impacts more than just the ability to conceive, but also the health and viability of the pregnancy itself.
Yes, the risks of specific complications become much more pronounced. The risk of chromosomal issues, for example, is a primary concern. The chance of conceiving a child with Down syndrome rises significantly to 1 in 100 at age 40, and then sharply to 1 in 30 by age 45. There are also increased risks for other chromosomal abnormalities like Patau syndrome and Edwards syndrome. Additionally, some studies even suggest a potential link between advanced maternal age and increased risk of autism spectrum disorder in offspring, although this area of research is complex and still ongoing.
And the miscarriage risk, which was already climbing noticeably in the 30s, becomes even more significant and heartbreakingly high in the 40s. Yes, tragically so. The miscarriage risk at age 40 is approximately 40%, meaning nearly half of pregnancies conceived naturally may not carry to term. This devastating risk can increase to around 80% by age 45. That's 4 out of 5. As we discussed, a majority of these early miscarriages are due to chromosomal abnormalities in the embryo.
Beyond that, older mothers face higher risks of various maternal health conditions during pregnancy, such as gestational diabetes, preeclampsia, that serious blood pressure condition placenta previa, where the placenta covers the cervix, and placental abruption, where the placenta separates prematurely from the uterus.
These are undeniably serious considerations that require careful management. What about complications specifically during the birth process for mothers over 40? Birth complications are indeed more common. Older mothers have a higher risk of having a baby with either low or high birth weight, macrosomia, preterm labor, and birth, and a significantly higher chance of needing a C-section, nearly a 50% chance for mothers over 40, half of them. This is often due to factors like the uterus being less efficient at contractions or higher rates of fetal distress during prolonged labor. And tragically, there are also higher rates of stillbirth and, though still rare, thankfully, maternal mortality.
That's a lot of information, and hearing those statistics can sound quite alarming, even daunting. But it's so important to remember the nuance here, right? These risks don't just appear overnight on a woman's 35th birthday.
Precisely. It's absolutely crucial to understand that these risks increase gradually as part of a biological continuum, not instantly at an arbitrary age like 35 or 40. It's not a switch that flips. Furthermore, any pre-existing health conditions a woman might have, such as endometriosis, uterine fibroids, chronic high blood pressure, obesity, or diabetes, tend to become more impactful and potentially complicate pregnancy outcomes more significantly with advancing age. These conditions can compound the age-related risks, making comprehensive preconception health management incredibly vital.
And it's not just about the mother's age either. The male partner's age can also play a notable role, which is something often overlooked in these discussions about fertility.
That's an excellent and often neglected point. While men typically remain fertile much longer than women, sperm quality does indeed deteriorate with age, though at a much slower and less predictable rate. Older men's sperm can have a higher rate of genetic defects, and recent studies have suggested potential links between advanced paternal age and conditions like schizophrenia and autism in offspring. So it's increasingly clear that male age is a contributing factor in the overall equation of later parenthood and reproductive health, even if it's not as pronounced as the impact of maternal age.
Despite these increased risks, and they are significant, there are still equally significant advantages to later parenthood that often aren't highlighted enough. What are those profound benefits that encourage so many women down this path?
The advantages primarily revolve around maturity, stability, and accumulated life experience. Parents who choose to delay often come to parenthood more financially and professionally secure, having had more time to establish robust careers and build significant savings. They often possess stronger relational foundations, having invested years in building resilient and communicative partnerships. This can lead to potentially wiser, more patient, and more emotionally regulated parenting decisions. Studies have consistently shown that older mothers are generally better educated and less likely to use physical or verbal punishment, often employing more gentle and communicative approaches. They've had more time to develop their own identities and self-awareness.
And there are even financial benefits for the mothers themselves, beyond just having more savings in terms of their long-term earning potential.
Yes. Intriguing studies have indicated that women who have children later in life may experience less of a motherhood wage penalty compared to those who have children in their 20s and early 30s. This means their lifetime earnings are less negatively impacted by having children, likely because they've already established a stronger foothold in their careers and are further up the ladder, making it easier to absorb the temporary career pauses or adjustments that motherhood often entails. Their earning trajectory is more robust before children enter the picture.
Wow, it's clear that while the risks do increase with age, there's also so much proactive medical guidance and personal empowerment available. What kind of specialized care and comprehensive management should someone expect and indeed seek out for an AMA pregnancy?
This raises an important question. How do we shift the narrative from solely focusing on the often highlighted risks of later pregnancy to also acknowledging the significant advantages and the multitude of proactive steps women can take to ensure a healthy journey? The first and most crucial step for anyone considering pregnancy, especially after 35, is a thorough preconception checkup. This visit with your healthcare provider before you even conceive is absolutely vital for identifying any underlying health concerns and comprehensively preparing your body for the demands of pregnancy. It typically involves a detailed review of your medical history, a thorough physical exam, and often baseline urine and blood tests to check for conditions like anemia or thyroid issues.
And managing any existing health conditions seems incredibly important to minimize potential complications, both to the mother and the baby.
Absolutely. It is highly recommended to proactively address and effectively manage any pre-existing conditions like high blood pressure, obesity, thyroid disease, or diabetes before becoming pregnant. This might involve working with your primary care provider or specialist to get these conditions under optimal control. Likewise, a critical step is reviewing any prescribed medications, over-the-counter supplements, and vitamins with your doctor, as dosages or types might need significant adjustment or even cessation for a safe pregnancy. For instance, some common medications for acne or blood pressure are contraindicated in pregnancy. You have to be careful.
What about genetic considerations, given the increased risks we discussed earlier for chromosomal abnormalities? This is often a source of anxiety for many.
Genetic counseling is a key component of specialized care for AMA pregnancies. A genetic counselor can provide invaluable guidance, helping you assess any specific concerns about genetic disorders or birth defects based on your family history or age. They will also guide you through various screening and diagnostic options. This can include non-invasive prenatal tests, NIPT, like cell-free fetal DNA blood testing.
That's just a blood test.
Yeah, a simple blood draw from the mother, which screens for common chromosomal conditions. Or advanced ultrasounds that can detect structural abnormalities. For more definitive diagnoses, more invasive tests like amniocentesis or chorionic villus sampling, CVS, are also available, and your provider will explain all your options thoroughly, outlining the benefits and very small risks of each.
Beyond initial screenings and genetic counseling, does the routine prenatal care schedule change for AMA pregnancies? Will a woman be seeing her doctor more frequently?
Yes, often. Your doctor or midwife will typically want to keep closer tabs on you and your baby's development. This can mean more frequent prenatal appointments to monitor your health and the baby's growth, and often additional tests beyond standard screenings to ensure the well-being of both mother and baby. For example, more frequent ultrasounds may be recommended to monitor fetal growth and placental health. Additionally, ensuring your vaccinations are fully up to date, including the Tdap, that's the tetanus, diphtheria, and pertussis vaccine, as well as RSV, flu, and COVID vaccines, is very important for protecting both you and your newborn from serious infections.
And healthy lifestyle choices, which are always important during pregnancy, become even more critically emphasized here, don't they?
Precisely. Taking a prenatal vitamin with at least 400 micrograms of folic acid daily is paramount from the moment you start trying to conceive. Eating a well-balanced diet rich in diverse grains, an abundance of fresh produce, lean protein sources, calcium-rich foods, and healthy fats is crucial. Simultaneously, it's vital to carefully avoid foods identified as dangerous during pregnancy, such as undercooked meats or high-mercury fish. Limiting caffeine intake to under 200 milligrams a day, maintaining regular dental checkups due to the increased risk of pregnancy gingivitis, engaging in regular moderate exercise, and implementing stress reduction techniques are all vital components of a healthy pregnancy. And of course, completely avoiding tobacco, alcohol, illicit drugs, and exposure to toxic substances like certain cleaning chemicals is absolutely necessary for a healthy pregnancy. It's common sense, but critical.
That's a really comprehensive set of recommendations. It undeniably shows that even with increased risks associated with age, there are numerous proactive medical strategies and personal lifestyle choices that can significantly manage and support a healthy pregnancy. This brings us powerfully to Section 4, Empowering Choices, Fertility Preservation, and RT. It sounds like assisted reproductive technologies, or RT, are truly changing the game and redefining what's possible for family building.
They absolutely are. ART methods, particularly in vitro fertilization or IVF, offer significant and often successful chances of pregnancy even as natural fertility declines. While success rates for IVF using a woman's own eggs do naturally fall after age 35, they remain remarkably high, around 50% or more, when using donor eggs, even for women well into their late 40s. This is a game changer for many, really opens doors.
That's a crucial distinction that really separates the two factors. So even if a woman's own eggs have aged and declined in quality, her uterus can still be perfectly capable of carrying a healthy pregnancy.
Exactly. The uterus, in most cases, often remains healthy and fully capable of supporting a pregnancy, which is why donor eggs are such a successful and increasingly utilized option for many older women. This fundamentally separates the egg quality factor from the uterine capacity, offering a pathway to motherhood for women whose eggs may no longer be viable.
And a major player in RT, and something we hear more and more about in popular discourse, is egg freezing. Can you explain what that entails and why it's become such a buzzword in recent years?
Sure. Egg freezing, formerly known as oocyte cryopreservation, is the process of retrieving mature eggs from a woman's ovaries and then freezing them for later use, typically with IVF. It's essentially a proactive way to extend your fertility and preserve your reproductive options for a time when you are ready to become pregnant. While the first baby conceived with a frozen egg was born back in 1986, it's the dramatic improvements in freezing technology, specifically a flash freezing method called vitrification, and subsequent success rates since then that have led to its exponential growth in popularity. It's a true medical breakthrough.
And that growth in adoption and use has been absolutely phenomenal, hasn't it? It seems to be skyrocketing.
Astounding, actually. The statistics truly underscore its rapid mainstream acceptance. From 2010 to 2016, there was an incredible 880% increase in egg freezing procedures performed in the United States.
800%, wow.
Yeah, massive. Then, between 2016 and 2019, there was another significant 89% increase, and the trend shows no signs of slowing down. In 2021 alone, over 24,500 instances of egg freezing were reported. This truly highlights how many women are proactively exploring and embracing this option as a vital part of their life planning.
So why are so many women from different walks of life choosing to freeze their eggs now? What are the primary motivations driving this massive uptake?
There are three main overarching reasons that emerge from our sources. The most common, representing a significant majority of cases, is simply to buy more time. Many women aren't ready for pregnancy in their peak fertility years for various valid reasons. They may be waiting to achieve more substantial financial security, complete demanding educational programs like medical school or a PhD, or very commonly, they're waiting to find a suitable life partner with whom to build a family. Freezing eggs allows them to preserve viable, younger eggs to use later, essentially hitting a pause button on their biological clock.
That makes profound sense, giving women unprecedented control over their life timeline. What are the other key reasons?
The second major reason is to protect fertility during medical treatment. For example, cancer treatments like chemotherapy and radiation can unfortunately leave a woman infertile, so freezing eggs beforehand offers a crucial option for future pregnancy after treatment. It's also an important option for individuals undergoing hormone treatments for gender transition or for women at risk of prematurely reduced fertility due to specific medical conditions like severe endometriosis, large ovarian cysts requiring surgery, or a family history of early menopause. It's about preserving potential when facing medical challenges.
Okay, that makes sense too. And what about the third reason for choosing egg freezing?
The third reason is to avoid discarding embryos during IVF. In a standard IVF cycle, often more eggs are fertilized than are immediately needed or transferred. Freezing unfertilized eggs allows clinics and patients to only fertilize the number of eggs necessary for immediate use and then save the remaining unfertilized eggs for potential future pregnancies. This avoids the often complex ethical and emotional considerations associated with discarding unused embryos.
That's a really thoughtful and ethically conscious approach to the IVF process. When it comes to the best age for freezing, what do the experts recommend for optimizing success? Is there a sweet spot, biologically speaking?
Experts are quite clear on this. They generally recommend freezing eggs before your mid-30s. This is precisely because both egg quantity and, critically, egg quality begin to significantly diminish with age. While it's still possible to successfully freeze eggs later in life, the younger the eggs are when they are retrieved and frozen, the higher the chances of success will be down the line when they are thawed and used for IVF. It's about maximizing the long-term viability and potential of the stored eggs. Most clinics will also discuss the ideal number of eggs to freeze, which increases with age, to give a good chance of a live birth.
So if someone makes this significant decision to go forward with egg freezing, what does the entire process actually involve? It sounds like a substantial undertaking, both physically and emotionally.
It is indeed a multi-step and intensive process, but one that is remarkably standardized and managed by specialized clinics. It begins with an initial consultation with a reproductive endocrinologist. This specialist assesses individual factors like your age and overall health, and crucially, conducts a blood test to determine your ovarian egg reserve, which indicates how many eggs you might yield. If you decide to proceed, the core process takes about 2 weeks. During this stimulation phase, you'll self-administer daily fertility drug injections for approximately 8 to 12 days. These medications stimulate your ovaries to produce multiple mature follicles, essentially tiny sacs that contain the eggs far more than the single egg normally released each month.
So a significant boost in egg production. What happens once the follicles are ready?
You'll also take another medication concurrently to prevent premature ovulation, ensuring the eggs remain in the follicles until they are ready for retrieval. Then, precisely 32 to 36 hours before the retrieval, you'll administer a final maturation shot, often called a trigger shot, which prepares the eggs for their final maturation. The egg retrieval itself is an outpatient procedure, typically lasting a mere 20 to 30 minutes, performed under light sedation or anesthesia to ensure comfort. A thin needle is gently inserted through the vaginal wall, precisely guided by ultrasound imaging, to meticulously withdraw the mature eggs from the follicles. The number of eggs retrieved can vary significantly per person and per cycle, ranging from a handful to over 20.
And once those precious eggs are retrieved, how are they processed and stored for future use?
The mature eggs are then carefully assessed in the lab. They are then flash frozen using that advanced method I mentioned earlier called vitrification. This ultra-rapid freezing process minimizes ice crystal formation, which can damage cells. The vitrified eggs are then immersed and stored indefinitely in tanks of liquid nitrogen at extremely low temperatures. When you are ready to try to conceive in the future, years or even decades later, these eggs are carefully thawed, injected with sperm to create embryos via a process called ICSI, and then the developed embryos are typically placed into your uterus, usually one at a time, to attempt pregnancy.
This sounds incredibly empowering, truly offering a pathway to future parenthood. However, it also sounds like it comes with a significant price tag. What are the typical cost implications of egg freezing?
You're absolutely right. The costs are substantial and represent a major barrier for many, although typically less than a full IVF cycle. Estimates for a single egg freezing cycle, including the necessary medications, can range from $4,000 to $6,000. The procedures themselves, the ultrasound monitoring, specialist doctor supervision, and the egg retrieval can add another $5,000 to $13,000. On top of that, there's an annual storage fee for the frozen eggs, typically around $500.
$500 a year just for storage. And I imagine one cycle isn't always sufficient to collect enough eggs to guarantee a good chance of success later on.
That's correct, and it's a critical point for cost planning. It often requires multiple cycles to collect a sufficient number of eggs to have a genuinely good chance of successful IVF later on, particularly if you're older at the time of freezing. Each subsequent cycle, while potentially slightly cheaper for monitoring, still incurs significant medication and retrieval costs. Unfortunately, most standard insurance plans in the United States do not cover elective infertility treatment, though there are growing exceptions, particularly for those undergoing cancer treatment where fertility preservation is a medical necessity. It remains a major financial consideration for many women.
Beyond the financial aspect, are there physical risks or common side effects associated with the egg freezing process that women should be aware of?
Yes, like any medical procedure, there are risks and side effects. Common, though usually temporary, side effects include mood swings due to the high estrogen levels from the stimulating medications, bloating from enlarged ovaries, and some abdominal pain and discomfort after the retrieval. More serious, though less common, risks from the retrieval procedure itself include internal bleeding, infection, and nausea or vomiting from the anesthesia. There is also a rare but potentially severe risk of ovarian hyperstimulation syndrome, or OHSS.
OHSS.
Yeah, where the ovaries become excessively swollen and fluid leaks into the abdominal cavity, and in severe cases can even collect in the lungs. While rare, it requires close medical monitoring.
So while the technology is groundbreaking and empowering, it's not without its challenges and considerations. What about the actual success rates of using frozen eggs? Is the data definitive, or is it still an evolving field?
The data is indeed still evolving, and it's important to acknowledge that. The American Society for Reproductive Medicine, or ASRM, actually cautions against recommending routine egg freezing solely for delaying motherhood due to what they deem insufficient long-term data for a definitive live birth likelihood across all scenarios. However, some things are becoming clear. Your chances of success are significantly improved if you freeze your eggs at a younger age, ideally before your mid-30s, and if you freeze a larger number of eggs. Some studies suggest higher birth rates when 15 or 20 or more eggs are stored, giving more viable options for later use.
And is there a difference in success rates between freezing unfertilized eggs versus freezing embryos which are already fertilized?
Yes, there generally is a notable difference. Freezing embryos, which are fertilized eggs that have already begun to develop, is typically more successful because their potential for development is already known. They've successfully fertilized. Frozen embryos also tend to survive the thawing process better than unfertilized eggs, which can be more delicate. It's reassuring, however, that current research indicates using frozen eggs for IVF doesn't appear to increase the risk of birth defects or chromosomal abnormalities in the resulting children.
This brings us to a really interesting and frankly heartwarming new development in the fertility space that truly encapsulates the shift we're talking about: egg showers. This is such a fascinating development, acknowledging that the journey to parenthood isn't always linear and celebrating every step.
What exactly is an egg shower, and how does it fit into this broader narrative of empowered fertility choices?
It's a wonderful and increasingly common new form of emotional and communal support, truly. An egg shower is quite similar to a traditional baby shower, but instead of celebrating an impending birth, friends and family gather to celebrate someone embarking on the profound journey of freezing their eggs. It's a way to acknowledge the significant, often physically and emotionally demanding, milestone in their fertility preservation journey. It's a powerful cultural embrace of a previously private medical decision.
So it's not just about the medical procedure, but it's about the emotional and communal support surrounding a highly personal choice. It's about recognizing the effort and hope involved.
Precisely. The core purpose is to provide emotional, practical, and even physical support for what can be a strenuous and expensive process. It recognizes that the decision to freeze eggs is a major step towards potential future parenthood, a strategic investment in one's future family, and it's worthy of celebration. They're typically held when the decision to freeze eggs has been made, or just before or during the medication phase, when that boost of support and acknowledgement is most needed, and when the emotional toll can be highest.
That makes perfect sense. Are there any particular themes or activities involved? I'm picturing a cooler full of eggs, perhaps literal ones.
Well, you could certainly get creative with that. Themes can be quite fun and playful, drawing on pop culture references like Ice Ice Baby, or even breakfast-themed brunches with plenty of eggs and bacon, symbolizing fertility and new beginnings. Some activities might playfully draw inspiration from traditional baby shower games, or even include symbolic gestures like hitting a clock-shaped piñata to symbolize beating the biological clock. But ultimately, the core purpose isn't the games or the gifts, but creating a supportive, empathetic, and celebratory atmosphere with those closest to you. It's about recognizing and validating this proactive and brave choice for their reproductive future, shifting the narrative from a private struggle to a celebrated milestone.
If we connect this to the bigger picture, it highlights a crucial and very welcome shift in how society is beginning to recognize, normalize, and openly celebrate the proactive choices women are making for their reproductive futures. It truly encapsulates the full scope of our deep dive today, from biological reality to personal empowerment.
It truly does. We've covered a remarkable and complex journey, haven't we?
We certainly have. We've journeyed through the dynamic and ever-changing landscape of female fertility, from the biological prime of the 20s through the increasingly popular and complex terrain of the 30s, and then bravely into the later decades, where advanced medical science and profound personal determination are reshaping what's possible for aspiring parents. We've seen, unequivocally, that while age undeniably impacts fertility, factors like meticulous lifestyle choices, proactive health management, and crucially, access to assisted reproductive technologies provide meaningful and empowering agency for individuals.
And that agency, that ability to choose and plan, is truly key. This deep dive has hopefully armed you with far more than just surface-level knowledge. It's moved beyond simple statistics to offer a deeper, more nuanced understanding of the facts, the inherent trade-offs, and the expanding opportunities that exist at each stage of the reproductive journey. It's about being truly informed, understanding the complexities, and feeling empowered to make the best decisions for your own life and your own vision of family.
Absolutely. So as we wrap up this deep dive, we leave you with this thought to ponder. What does it truly mean to be ready for parenthood in an era where biology is increasingly flexible thanks to science, and individual choice plays an ever more significant, perhaps even dominant role in shaping our family timelines?